desk most of the day. All right. So let's jump right into it. Yep. There we go. So Alex already did a great introduction. So there's me. He already gave you a lot of this information. I work for Airrosti Rehab Centers. I'll do a quick little commercial at the end today, kind of on what we do. That's me and my daughter Adeline. We just moved to the Charlottesville area over the summer and completely loving the outdoors options that are available here. So just wanted to share that. So quick overview of what I want to talk about today. I want to talk about pain. It's a lot more complex than we think. We tend to think of pain as being this 1-to-1 ratio of however much damage has occurred locally in the tissue. That's how much pain we're going to experience. But it's a little more complex than that. We'll talk about some tools for preventing or helping to kind of self-treat if you have some pain already. And then, like I said, I'll do a little commercial at the end to talk about Airrosti Rehab Centers and what we do and why we're different. So let's talk pain. So this here represents what we call the biopsychosocial model of pain. And essentially what we're talking about here is that pain is complex. There's a lot of different factors that play into the pain experience that one person might have. You can see that there are certainly biological factors. So, tissue damage or tissue health. If you eat a lot of fast food and your physiology isn't all that great, that could factor into it. But there's also psychological factors and social factors that can augment one's pain experience. So I'll use an example here. Let's say that someone bends over to lift something and they tweak their back. They have a little bit of back pain. And maybe they've had a few injuries like this in the past and they kind of blow it off. Oh well, I'm going to be in pain for a couple days, but I'll be fine. No big deal. So that's one individual. Let's take someone else who has the exact same injury. They bend to lift something and hurt their back, but this person has, let's say, parents who've both had back surgeries. And those parents are telling them you need an MRI right away, and this could be really, really bad, and you might need to get surgery just like we are or had to, and you're going to be disabled like we are. So now you're seeing some of these psychological factors starting to play in, where maybe they're starting to have some anxiety and some catastrophic thinking about the injury because of some of those social factors that are playing in. And those two individuals might have completely different pain experiences, even if they've suffered the same exact injury. So we need to be aware when it comes to pain of all of these potential factors. Pain is it's complex to say the least. And anyone who gives you a one-size-fits-all approach to any kind of treatment of pain is probably missing a lot of things because, again, there's so many factors that play into it. Now, as it pertains to those of us that are stuck behind a desk all day, I think one of the main drivers of a lot of the pain that people develop is just inadequate movement. You're sitting there, you are not moving. Even if you get up and you use the restroom and you walk to the water fountain, maybe your legs have gotten some movement, but your neck, your shoulders, your back got very little movement as you got up to do those things. So why that really is pertinent here, I want to talk about pain gait theory. So that's what's depicted in that picture on the left, which kind of goes into some detailed neurology that we don't need to get all in the weeds about. But all of us have experienced pain gait theory before. Essentially, the picture here that's showing you hit your thumb with a hammer on accident, and your thumb is throbbing. And so your first reaction is to maybe start massaging your thumb, putting some pressure on it, or maybe you start shaking your hand, and that brings you some relief. So as long as you're mechanically stimulating that area or you're applying pressure, that can override your brain's perception of that pain. So the reason I bring that up is movement helps to override our perception of pain. And if you are sitting there at your desk and you are not moving for hours upon hours at a time, you are going to have this upregulation of the conduction of pain, of your brain's paying attention to pain because of that lack of movement. So in essence, we need to move more. If you are just sitting there and you're not moving at all throughout the day, it's kind of expected that you will have some pain from that. So that's pain gait theory. Along that same vein, I put local tissue hypoxia. Hypoxia just means a lack of oxygen or decreased oxygen. So let's say you're sitting there, you're staring at your computer, your shoulders are rounded forward, your head's kind of hanging out in front of your body, and all of those muscles and tissues in your upper back and neck are in a stretched tension position. That's going to occlude some of the blood flow to those muscles. All the capillaries that bring oxygenated blood are not able to do so as well. And so you start to devoid that area of oxygenated blood. And that's going to essentially force those tissues to start to rely on a different way to get the ATP, the energy that they need to continue to hold you up in that position. You're going to rely on essentially the same pathways that we use with really high intensity exercise. So you might start to use things that are going to cause lactic acid buildup in those muscles because of that lack of movement, because you're not getting good inbound blood flow. So again, getting some movement would really help to facilitate local blood flow and could definitely reduce some pain. And then lastly, you see there prolonged deviations from neutral. Think of neutral as being kind of a mid-range position. It's what people generally think of as being good posture. So it's somewhere between in range, if we're talking our neck here, getting your chin all the way down to your chest versus looking all the way up to the ceiling. If you were to cut that in half and find the midpoint, that is kind of your neutral position. And if you're spending long periods of time where maybe your head's way ahead of your body or you're staring down at your phone for extended periods, those prolonged deviations from neutral, we just don't tend to handle quite as well, and can definitely make the pain come on faster. All right, so let's talk about how we can apply some of that to our day-to-day if we are behind the desk all day long. I want to bring this up real quick. Beware of the snake oil salesman. You know, this is a multi-billion-dollar industry. There are lots of people who promise big things when it comes to treating your pain. Very often, you know, very expensive things that are going to be very not only consuming of your wallet, but consuming of your time. So just be aware of those. You know, no one has a 100% success rate when it comes to treating pain. And if it sounds too good to be true, likely it is. All right, so I'm hurting right now. What are some things that I might be able to do to give me some relief? And you see, I've divided this up into two different categories. We've got on the left, the provider rendered strategies. So these are the things where you need to go see someone and this someone needs to do something to you. So you go to your chiropractor to get adjusted or your massage therapist for a massage, your acupuncturist, etc. And then on the right, we have these self-driven strategies, things that are within your own locus of control, things that are in your own toolbox that you can do on your own that you don't need anyone to help you with. The more that we can start to get away from those provider rendered strategies, again, not that they're bad things and there's a time and place for all of them, but the more that we can have a lot of tools in our own toolbox, the more self-empowerment that we can have. I think that's really powerful. And when it comes to long-term outcomes, those who have more self-empowerment generally tend to do much, much better than people who feel reliant on others for the treatment of their pain. So you'll see in that right column there that I've got a few things italicized. I want to highlight those. All right, so movement snacks, that's the term that you see up there at the top. Just like you might snack on some food throughout the day, I'm suggesting to you here to snack on some movement throughout the day. Frequently throughout the day, have a few things that you can do to try to get a little bit of movement baked into what you're doing. So I'll show you on the left there, I'm making some big neck circles. You'll see that the circumference of that circle is pretty big. I'm really trying to explore my end ranges of motion. It's not just a little small circumference circle. And that way, you know, all those tissues in my neck and all the joints in my neck are all getting good excursion of movement, a lot of, you know, good things happening, as opposed to just really small movement where I'm only, you know, maybe getting certain tissues to stretch a little bit, maybe just a little bit of movement in the joints in my neck. And then similarly, and Quentin, I just saw you kind of doing these. So the one on the right here, some shoulder blade circles. So I'm just moving that shoulder blade in big circles over my rib cage. Again, if you picture that you're sitting there typing for hours with your hands in front of you, your shoulder blades might just be stagnatedly sitting affixed on your rib cage, not getting any movement. So doing these shoulder blade circles is a great way to infuse some movement into those tissues. And both of these, you know, this is something that you could do every hour. Just go ahead and do a couple repetitions of each one. On the next page here, you'll see me doing something more that's spinal in orientation. So I'm going back into extension, and then I'm reaching forward and getting some flexion of my spine. So just getting a little bit of movement back and forth through my spine. Nothing dangerous about doing these. Generally, you'll feel pretty good when you do these. Now, obviously, with any of these, everything I've shown you today, this is not medical advice. I haven't had a chance to consult with any of you individualistically. So if any of these things are painful to do, then I would certainly encourage you to discontinue them until you've had that evaluated. But if these feel pretty good, definitely full steam ahead. I think they're real good strategies. Self-massage can be another really potent tool to utilize. So both of the models here are using lacrosse balls, one in the lower back, one in the upper back, to do some self-massage over some of those tissues, areas that we generally tend to hold a lot of tension and stress. So literally a $2 or $3 lacrosse ball and a wall, and you can get a lot of good work done, just rolling up and down along those muscles. And you might find, several hours of relief after doing this in areas that we tend to hurt. And then similarly, the girl on the left has a massage stick to do some massage along the back of her neck. The girl on the right is using a lacrosse ball again to massage her upper trapezius, the muscle that goes from your neck to your shoulder, just using a wall corner to do that. So some good, simple strategies. You don't need anyone to help you with these, but quick ways when you are hurting a little bit that you can get some real quick relief. Real potent tools and strategies to have there. And then I really want to highlight this one. So changing positions. I know that standing desks have become a lot more popular here lately. I'm a big fan. I don't necessarily encourage you to stand all 8 hours or what have you that you're at work, but breaking up the sitting as much as you can is a real powerful tool. You can see here that I'm kneeling down, so you could kneel on one knee, you could kneel on both knees. If you're working from home and you're not on a Zoom meeting or something like that, you could go lay in your bed for a little bit and do what you're doing. So adopting a multitude of positions throughout the day, I think, is really powerful. It's a way to just ensure that you're not overloading any particular tissues. There's even treadmill desks that have become popular here lately. I'm a huge fan of those. You walk for about a mile an hour on your treadmill as you're working on your computer. And not only are you getting some movement, but you're probably burning another 1,000 to 1,500 calories throughout the day. So real powerful tool there as well. All right. So a lot of those were things that you can do when you're kind of hurting in the immediate. And I think that all of those are particularly powerful. Again, the changing positions regularly, I think, is a real powerful long-term tool to also be using. And the movement snacks, making sure that you're getting that frequent movement throughout the day is definitely something that I encourage as not only a short-term, but also a long-term strategy. But long-term, if you're really wanting to get to a point where you're not constantly having to do something to manage the pain that you're suffering from, if you want to get to a point where you're rarely in pain anymore, I think these are some real powerful things that you can be working on. So number one is building some local muscular endurance, and particularly in the muscles in your neck and your back. I'll show you a couple examples here in just a minute that you might want to utilize. But an example that I could use here, has everyone done that wall sit exercise where you sit back to a wall, your knees and hips are at a 90-degree angle? You probably have done that in a boot camp class or PE back in the day. Now, if you were someone who exercises regularly, you do your squats, you do your running, and you've got good fitness in your legs, you are probably going to last a lot longer than someone who doesn't do anything fitness-wise. And that intuitively makes sense. Well, the same would go for all those muscles in your upper back and your neck. If you've done things to build some fitness in those muscles, you are going to have better endurance so that when your posture isn't all that, you can still tolerate being in those positions for longer periods of time versus someone who doesn't have great endurance in those muscles. So building some local muscle endurance is a real powerful strategy that you might want to employ. We've already alluded to the second thing there, but developing more habits for more movement throughout the day. Everyone seems to have Fitbits or Apple Watches these days. Shooting for that 10,000 steps, while it's an arbitrary number, I still think a very powerful tool to utilize to make sure that you're getting up and moving around. At the very least, if you just got a pedometer, it's going to inform you potentially as to how little you're moving throughout the day. Starting to aim for that 10,000 steps over time, I think, is a really good habit to build. And obviously things like parking far back in the parking lot and other little strategies like that to make sure you're getting more movement throughout the day, I think are really critical. And then these last 4 things are really just all about being in better health, building better aerobic fitness, getting better sleep, longer duration sleep, improving your mental health. If you remember that first slide, that biopsychosocial model, depression and anxiety can be major drivers for chronic pain. So if you're suffering from any of those, working on those things, doing some meditation or potentially seeing a therapist, eating an anti-inflammatory diet, which, there's a lot of argument back and forth between different camps on what the ideal diet is. But generally, we can all pretty much accept that going to McDonald's, every single day is probably not a great thing for you. And eating more kind of whole food foods is probably better for you in the long term. So just getting in better health is generally a really good thing when it comes to getting pain under control as well. I'll pause there before I get into my, actually, no, sorry, I have a couple endurance exercises that I want to run past you real quick. So this one is called the wall angel. So find a little bit of wall space, get into a quarter squat, and then get your back and your neck as close to the wall as you can. And then you're going to rotate your arms back to this 90-90 position you see me in. And then while you keep your back affixed to the wall, you see here, I start to slide my forearms up the wall without my back or my neck coming off the wall. It looks like a really easy exercise, but you can kind of tell by the grimace on my face there, it's actually a lot harder than it looks. It's a great stretch through your pectoral muscles and a lot of the muscles in the front, but you'll get a fantastic burn through a lot of the muscles in your upper back, even just a few reps into doing this. So this is a great way to build some endurance in those upper back muscles. And then similarly here, this is the Cobra, but laying on your stomach and just lifting your face and your shoulders a bit away from the floor, rotating your arms. So basically going into the exact opposite of what a bad postural position would be. And because I'm laying on my stomach, I'm now in a plane that gravity is working against me. And I might hold those top positions for 10 seconds at a time. So I'll pause there before I do my little Airrosti commercial. Does anyone have any questions with anything I've presented, or any need to elaborate further on anything?
Dr. Taylor, just one question.
Yes.
So if a person can't actually get in 10,000 steps because, maybe what they do they just can't do it, what's a minimum they should strive for that would still be good?
Yeah, I mean, it's all somewhat subjective. I would push back on that a little bit and say, I would say that, striving to get that number is important, because it means that you're, how can I put this? That there are certain things that we need to do to ensure optimal health. I mean, yes, all of us could be doing the drive-through, 3 meals a day, every day, and we're going to live for a certain period of time doing that. We could all smoke, and we're not going to die from one cigarette, and we're not going to potentially die from packs and packs of cigarettes, but eventually those things catch up to us. So the 10,000 steps, while it's an arbitrary number, I think the more that we can shoot for something like that, it's just checking that one more box that we're doing something that's going to be better for us in the long haul. So if you can't get that 10,000 steps, certainly shooting to get as many as you can. If you're getting 1,000 steps a day, or you're getting 800 steps a day, I mean, that's really got to be a wake-up call to you that you need to absolutely get more movement. And it's kind of obvious that you're going to potentially be hurting if that's all you're getting.
Right.
I don't know if that was a great answer, but
yeah, I get about 8,000, and I've only hit like 10,000 maybe twice, 15,000 a couple of times, but I'm trying to get to that 10. And I don't know why, it just seems like a struggle some days. But
8,000 ain't too bad. Yeah, that's really not too bad.
Well, and maybe you all could, for those of us who don't have, the watches and everything, can you translate 10,000 into something that we could get our minds around? Yeah,
I mean, that's probably going to be about 4 to 5 miles for most people, depending on the length of your stride. So it's a decent amount, but if you take, that's not just you specifically going out and walking your neighborhood or going on a hike, we're talking all that low level movement that you're getting throughout the day, just walking into the kitchen to grab a snack and, those types of things. It does accumulate after a while. Yeah, but you're looking at about 4 to 5 miles altogether.
I had a question.
Mm-hmm.
I was wondering if you had any recommendations for orthopedic shoes or work shoes, because I know, we spend a lot of time at work in our shoes, and it has a big factor in back pain.
Sure. So interestingly, really since about the late 1960s, early 1970s, shoes have gotten a lot more cushiony, a lot more supportive, and the incidence of foot issues has only risen since that time. So, and there's certainly exceptions to this, but I'm generally not a big fan of real supportive shoe wear unless you're putting in lots of running mileage, or maybe you are on your feet the entire day, every day. You're working in a hospital or something like that. You never get a chance to sit down. I'm a lot more of a fan of what can we do to strengthen our foot musculature. I'll put it this way: our feet should be about as dexterous as our hands. So as easy as you can, put all your fingers together and type and do things like that, you should be able to do the same thing with your feet and with your toes. But because we're stuck in shoe wear that's cushiony, we're walking on flat, monotonous flooring all the time. It's basically like we have oven mitts on our hands all the time. We would lose that dexterity in our hands. So my recommendation, and again, if you have a legitimately collapsed arch that is a structural problem, then that might be an exception to this. But for most people, I think working on building some foot strength would probably go a lot further for you than chasing down the ideal footwear.
Question, doctor?
Yeah.
Yeah.
So I'm flat-footed.
Mm-hmm.
And so what is your opinion on back support belts, and what are the things that you would suggest that someone who's flat-footed needs to concentrate more on outside of going to the chiropractor and so on and so forth?
Sure. So again, kind of similar to that last question, I would say do things to build some strength in your feet. And I obviously haven't included any exercises in this presentation on that. Maybe that would be something I'd be happy to come back and we could do a kind of foot-centric presentation at some point. But yeah, there's a lot of things that you can do to build strength in your foot muscles. You have a lot of muscles in and around your foot and in your lower leg that contribute to holding up your arch. So again, there are sometimes structural deformities that can cause someone to have bony changes that are going to be impossible to change. But for the vast majority of people, when they have fallen arches, it's more of a muscular issue. The muscles have gotten too weak because, again, we're in that ultra supportive shoe wear all the time. There's no reason for our muscles to be strong in our feet when we're stuck in those shoes all the time. So doing some things to strengthen those up, I think would go a lot further. Obviously, in the short term, though, if you have really weak feet and you're going to be going on a run or doing something like that, then having a good pair of shoes is going to be critical then. But a great long-term strategy would be building more strength and endurance in your foot muscles. And then as it pertains to, wearing a back brace or anything like that, similarly, I'm not a big fan for most people. You have a lot of muscles in your trunk, in your core musculature, that really should do a lot of that for you. Now, if you've had, chronic back issues over the years and you have a real demanding physical job where you're picking up a lot of things, then I can make an argument that might be reasonable to employ in that type of situation. But for the vast majority of people, I think it's a lot more about how can we get your core to do what it's supposed to so that you can basically use your own intrinsic weight belt, not a external one that you're having to put on to do things like that.
Ooh, thanks.
Yep.
Alex, we got any other questions?
I actually, oh, go ahead.
I just have, it's just out of general knowledge and wanting to know, Dr. Levick, have you seen a tremendous increase in the number of individuals who report having pain? I guess I'm interested in
what has happened to people during the pandemic. Like, I think that your business model is so needed at this point in time, and whether people are accessing you or not.
So yes and no. So what I've really, I mean, obviously early on in the pandemic, our numbers didn't look too good, but that's because no one wanted to go into a 10 by 10 room with someone for a while in the midst of the pandemic. But one thing that I've really noticed a lot of over the past 2 or so years is a lot more pain that is becoming chronic, that is getting harder and harder to resolve. And fortunately, I get an hour with all my patients, so it's a lot more time to kind of dig in and learn more about my patients, learn more of what's going on kind of behind the scenes. And, you know, a very strong correlation I've noticed with financial stress, with just stress about politics and things happening socially in the world, things happening in families, stress over the pandemic itself. A lot of that is then causing what would otherwise typically be a pretty easy to fix injury, making it become a lot more chronic and a lot more difficult to treat. And again, pointing back to that biopsychosocial model that I was talking about earlier, I think there's just a lot more psychological and social stuff at play than there probably was a couple of years ago.
That's interesting. That's good to know. Thank you for sharing that.
Mm-hmm.
Dr. Levitt, I had a quick question in terms of when you're at your workplace. I mean, are there places, I work on a computer screen pretty much all day. Are there positions like should the computer screen be at a certain height for me to make sure that I'm not in a bad posture? Like, should my chair be at a certain height relative to my feet to the ground? Should my feet be touching the ground or higher? I'm curious how I should sort of position my workspace to reduce that bad tension.
For sure. Well, you know, again, with the caveat, you know, get more movement throughout the day. But for those times that you are going to be sitting there for a while and not getting much movement, as I was talking about earlier in the presentation, those prolonged excursions from kind of a more neutral position are typically more detrimental. So if your screen is, let's say, a few inches below your line of gaze, so you're not looking straight ahead, but you're actually got your head looking down a little bit for a while, there's a lot higher likelihood that you're going to get some neck issues from that type of setup. So I would make sure that your screen is straight ahead, if not maybe even slightly positioned upwards, to, you know, keep you from being in that prolonged position of looking down. You know, another thing that might be helpful is make sure that you've got elbow support. So if your arms are free floating as you're typing or you're using your mouse, that's a lot more that those muscles in your neck and shoulder girdle have to work to support your arm. So if you can have your elbows resting on the table that you're using or on arm support, I think that could be a really helpful thing. Yeah, but in terms of like specific chair recommendations or any of that, and I would say the same thing. People ask me all the time about pillows. A lot of that is just so unique to the individual. I could make a recommendation of a certain pillow that's a patient told me about, and I tell the patient that, and they come back and tell me I bought it and it was a piece of junk and I threw it away. And same thing with office chairs. It's just so hard to pin down what's going to work for someone. So a lot of that is just going to be individual. You got to try it out and kind of make sure that you like it. But those are, you know, some kind of basic tips on workplace posture.
Thanks, appreciate it.
Yeah. Cool. Any other questions before I just give you a quick kind of Airrosti Rehab Centers commercial?
Well, Doctor, I have more of an operational question now.
Sure.
Now for your PowerPoint, do you have any other slides after this one that you need to show?
I think just like 2 quick slides on Airrosti, and that's it.
Okay, so after you show those, could you go back to the one with the 2 options with the so that we can have those on the screen again?
Yeah. The provider strategies versus the self-guided strategies. Absolutely. Well, here, I'll run through this real quick. So Airrosti Rehab Centers, we're based in San Antonio, Texas, and I operate our Charlottesville location. Our office is over by Centera, Martha Jefferson. But our company has seen well over 1 million patient cases now. We treat musculoskeletal injuries. So here, I'll go to this slide real quick. Here's a kind of not a full comprehensive list of what we treat, but some of the more common things that we tend to see. So everything from neck pain and headaches all the way down to foot and ankle issues and everything in between. And we tend to resolve these injuries in a pretty quick manner. So we average about 3 to 4 visits typically to get people, if not completely resolved, certainly to a point that they're very satisfied with. And we try to empower them with exercises and stretches they can be doing on their own to maintain a lot of that progress. You can see we've been able to help, and I think these numbers are a few years old now, so I think we're somewhere around 25 or 26,000 last I checked. Been able to prevent a lot of surgeries that were unnecessary, but that patients were thinking that they needed. You can see in that middle row there that we get almost 9 out of 10 people to full recovery. But a number that we're really proud of, you can see right next to that, almost 100%. So 99.5% of our patients would recommend us to friends and family. So even if you're in that 10% who were not able to fully resolve your injury, and we certainly can't resolve everything. There's definitely times where people need to go and get surgeries or get injections or get other treatments beyond what we're able to do. But most people really have a great experience with us. So that's something that we're really, really proud of. And one thing that I just wanted to point out real quick, this is something that we've started doing during the pandemic. A lot of folks are just nervous to get out in public still, and we want to be very cognizant of that. Or it's just very inconvenient to go and schedule a visit with someone. So we have our virtual injury and pain chat, or VIP chat, we call it. But you get to chat one-on-one with one of our providers for a full half hour, ask any questions that you have about your injury. You're not necessarily going to get a diagnosis from this, but you can basically be told if this is something that should be treated conservatively. Do you have an injury that maybe you just need to wait it out a little bit longer and it's probably going to heal up on its own? Or, hey, this sounds really, really bad. Let's find you a great orthopedic surgeon in your area that we can get you set up with, or get you some imaging for this type of injury. And this is a telemedicine option, so you can do it from your own home, no cost, no obligation. So just a great thing that we're offering if you want to chat with someone about any pain issues that you're having. Quentin, I will go back to that one slide you were talking about. Sorry, not the most efficient way to get there.
I appreciate it though.
Yeah, of course. Here we go.
Yeah, because I think just seeing those self-driven strategies, I know they're very helpful for me, because it's like it's a reminder that, hey, stupid, you got several things that you can do at home. You just got to incorporate it. I got to incorporate it into my daily routine.
Absolutely. You got to make it a habit.
Yeah. And so while we're here, I'll sneak in another question. I think I may have an idea of what's the difference, but I'd rather you go ahead and explain what's the difference between Airrosti and what you do and chiropractic services. Is it just because they concentrate on the back and you're holistic, or is it something else?
Yeah, so traditionally, and if you go to different chiropractors' offices, you're going to see a lot of different things. But traditionally, chiropractic is more about manipulation or adjustments of the spine, and the premise being that there might be bones that are out of place, and you're putting those bones back in place to remove pressure on the nerves that are coming off the spine. And so I think that chiropractic adjustments are a powerful tool, and I do still use them, not nearly as frequently as most chiropractors, but still use that. But I think our profession has kind of a bad reputation of, once you go see a chiropractor, then that's it, you're hooked. Like, you're going to have to keep going, once a week, the rest of your life type of thing. And I think a lot of that is, again, because that's a provider rendered strategy. You are reliant on that person to do that magical adjustment that makes you feel better. And there are certainly some great chiropractors who are showing their patients a lot of self-driven strategies. But it's kind of in the business model for a lot of chiropractors to maybe just keep you going on those adjustments for a while, because they bring you that quick relief. You feel good after you get that adjustment, and that's why you have to keep going forever and ever. So with us, Our hands-on treatment is more of a soft tissue treatment. So I'm using my hands and my elbows to get in and work more into the muscle tissue. Think of it more like a medical grade deep tissue massage. But then even more important is we are showing you a lot of those self-care strategies. What stretches can you be doing? What exercises can you be doing? What are the ways that you can ultimately manage your own pain so that you don't need to keep coming to see me for your injury forever and ever? We say frequently, we love our patients, but we're not trying to adopt them. It brings us more joy to pat them on the back and send them on their way, hoping that maybe they pass it along and they're telling their friends and their family about us versus, me seeing the same person for the next 10 years of their life. So I'd say that's where we kind of really veer away from kind of the traditional mainstream chiropractic.
Okay, cool.
Yeah. Great. Well, that largely wraps up my presentation. Are there any other questions that any of y'all have?
I have a question.
Mm-hmm.
Okay, so as we get older, Dr. Taylor, things just start hurting, and
Sure.
like with no explanation. Like you wake up, why is this hurting? You don't remember injuring it or anything. Obviously that's a normal part of life, I'm guessing, but when does it become a problem when you keep waking up, or just you're turning around with a new pain?
Well, first I'll kind of offer my thoughts on as to why that may be. Think back when you were in grade school, you're playing on the playground, you're running all over the place, you're hanging from the monkey bars, you moved a lot when you were young, and maybe you played some sports, and then, you get out of college, you graduate from school, and now you're in that office job, and all that movement that your body was very used to goes to the wayside. So I think that is why we start to develop a lot of those aches and pains that seemingly come out of nowhere. It's really because we've stopped moving. We're not moving as much as we used to. So that's, I think if we keep moving, I don't see any reason why when you're 70, 80, 90 years old that you need to be in pain. I think that there's a lot of people who keep moving. I think of, oh gosh, what was his name? The exercise guru from like the 50s and 60s. His name is
Jack LaLanne?
Yes, yeah. That guy, he was doing pretty good up until his final days. So, but it's just, he kept moving. So what was the second half of your question? I'm sorry.
I don't know.
Okay.
It was at what point do you need to, I remember it, Andrea. It was at what
Oh,
point,
good. Thank you, Alex.
At what point do you need to go from this is something normal
Right
to this is something I need to be concerned about if you're waking up with new pains?
Sure. So we're taught in school, and so are medical doctors and other healthcare providers, to look out for red flags, as they're called. And these are typically, things that might be more indicative of the big bad stuff, the cancer, the, heart attack, the stroke, et cetera. And so one thing that kind of helps us differentiate between, hey, this is pain of maybe a more mechanical, musculoskeletal origin, is that different changes in position, different movements will either, augment your pain in a positive manner or make your pain worse. So if you can make your pain worse by moving a certain way, and you can make your pain better by moving another way, then, if you can tolerate the level of pain, it's probably not something that you need to be particularly concerned about. I would certainly implore you, if it's getting to that point that it's starting to get intolerable, go get some treatment and try to get it figured out. But if you're having pain that's maybe waking you up in the middle of the night for no rhyme or reason, waking you up out of a cold sleep, and it's just gnawing pain that can't be mitigated by moving to different positions or anything like that, that's when I get a lot more concerned that it might be something a little bit worse. That's when I would definitely encourage you to go see a healthcare provider at that point. So, but I think we've also, in some respects, we've probably gotten a little soft over the years. I think a couple generations ago, people just were used to being in pain, and it was kind of, you just kind of dealt with it, and it is what it is. And now we've got this mentality that we should never be in pain, or life should never be hard at all. So I think, if you can deal with a little bit of pain, if you're having some neck or some back issues, but it's tolerable for you, I really don't think it's anything that you need to be particularly concerned about. But again, if it's occupying too much of your mental real estate, if it's interfering with you being able to do the things that you want to do, then definitely go get it checked out and get it figured out.
And that is a good point you brought up, because I don't necessarily want to be this person that runs to the doctor for every little ache and pain. I'll be there every week, but and just some things you just ride out, and
Absolutely.
they do go away, and do some of the self-driven strategies, of course. So don't want to ignore the pain, especially if it's chronic and, as you said, waking one out of their sleep, but also don't want to go looking for drugs to take it away either. But
yeah, kind of self-assess, what's my mental state on this? If it's something that I'm getting really concerned about, I'm having a lot of anxiety over this pain, I think it might be something really bad, or I'm now scared to do X, Y, and Z because of this pain. Those are indications that you really need to go talk to a healthcare provider and get it figured out. But if it's just, I have a little bit of back pain when I sit way too long at my desk, and it doesn't really stop me from doing anything else, and it's really not that bad, I would brush that off. Honestly, it's kind of part and parcel of having a body. So
that is, oh man, that might be the most resonating point. You've shared a whole lot of great information, but that really resonates with me, doctor, because I've had this mental thing of, because I've gotten used to pain over the past years. And I always was concerned that, man, you shouldn't be getting used to your pain like that. But you've just balanced that out. So my last question to you though is, like I mentioned earlier, I had a muscle spasm this morning, just washing my hands. And I had a spasm that almost put me on my knees. And Andrea, you be quiet, because I know you about to say something about that. You don't say nothing right now.
Q, we the same age, so I'm gonna sit in silence. Yeah.
All right, yeah, because you forgot your question, Grandma. So I shouldn't have said that. I'm sorry.
It's all right. I love it.
But anyway, with me getting that muscle spasm, typically when I get muscle spasms like that, it's because that I've had too much sugar intake. However, I haven't had a large amount of sugar intake in the last several weeks. So is there any other thing that could be a culprit for setting our bodies up for unsuspected muscle spasms and inflammation?
Yeah. I mean, going back to that biopsychosocial model that I was pointing out earlier, I mean, it could definitely be things from a specific tissue standpoint. A nerve issue in your back or a disc issue in your back could certainly trigger symptoms like that. But it could also be, as you were alluding to, too much sugar, dietary things, a whole lot of things that could potentially be causing that. My hunch is generally to get kind of the movement and tissue aspects of things kind of cleared out first. So I would imagine that you probably have some things going on locally in your spine that would need to be addressed. But yeah, I mean, it could be a whole lot of things, and I don't want to be too speculative since I haven't had a chance to, evaluate you personally, but yeah, it could definitely be a lot more than just the sugar intake for sure.
All right.
I see Kay has a question.
Last question, I promise. So Doc, could I also see you as a physical therapist type, or are you utilized as a physical therapist?
Yeah, so I mean, I am a chiropractor by training. That's the license that I operate under, but our company employs physical therapists as well. We do exactly the same thing, whether we're a chiropractor or a physical therapist. So, where we kind of, if you've done traditional physical therapy before, it can be kind of similar to the stuff I was saying about chiropractic. It can be a more long and drawn out process. You might be going 2 or 3 times a week for weeks and weeks. So, we're kind of a quicker, more to the point way of doing things. But if you're coming off of a major surgery and you're having to do surgery or do rehab after your rotator cuff repair or your ACL repair or something like that, then we're definitely not the fix for that. That's where I would definitely implore traditional physical therapy. But
I was
saying, yeah, go ahead.
I was thinking in terms of insurability. People have.
Yes.
How we could access you, could we use HSA plan, how people could utilize their benefit if possible for your
Yeah, so
services.
our company is in network with most major carriers. We do not have Medicare or Medicaid contracts, but all your Aetnas, Cignas, Anthems, et cetera. And then it would just ultimately come down to your individual plan, you know, what your deductible is and all that. The nice thing, if any of y'all were to schedule an appointment with our company, we verify all your benefits ahead of time. So we let you know, hey, it's going to be X amount on your first visit and this amount on your second visit. You're going to never have a sticker shock with us.
Okay. Thank you. That's a great answer. Appreciate that.
Of course.
I think we've got one last question that we'll do from Andrea before we switch to closing announcement.
Okay.
And I'm trying to figure out how to answer it, ask it, but you know, this being the Minority Business Alliance and the work we do, while for the business community, we do have a focus on the Black and Brown communities. So thinking about that, Dr. Levick, and the presentation you just gave, what should we know, Black and Brown folks, about just all of this? Because we know sometimes if it's a disease, the Black, Brown communities tend to get it worse, or because there's so many other factors involved. I'm not even sure what the question is, but it's in there somewhere. Maybe Q or K or Alex can help me, or somebody can help me, but there's a question in there somewhere that I know there's information that you have that's specific to the Black and Brown communities.
Yeah, I mean, I guess the one thought that comes to mind is just, you know, being better informed about a lot of these types of injuries and treatment strategies that, you know, there are a lot of things, like I was showing you on this slide here, there's a lot of self-driven strategies that you can do on your own that don't require, you know, big expensive treatment plans anywhere or big surgical interventions. Again, there's a time and place for all of those things, but there's so many things that people can do on their own that they should feel empowered with the vast majority of injuries. And nowadays with access to, granted, it's kind of a Pandora's box, but you know, you have YouTube and other ways that information has really just been outsourced, that it's so much more accessible than it's ever been before. You know, there's just so many things that I think we can do, or at least try, before we resign to having to do any of those provider rendered strategies that I've got listed there on the left.
I just wanted to say one thing that kind of clicked when you mentioned that about like the burden of being a minority earlier. I've always heard this saying, and it's ringing with me right now because it's involving the back, and it's basically you always carry your burden on your back. And a lot of times in this pandemic, within life, you have to prioritize your self-care. And just one thing that I do day in, day out is I think about doing yoga exercises, and a lot of the posture recommendations and yoga practices align similarly. So if anyone has time at work, looking up quick yoga instructions and following through with that at your desk or getting a yoga mat, that's something that I practice.
Absolutely. Getting all that movement we were talking about. And then, I mean, from like a psychological standpoint and all that, it's just so good for you mentally to do a little bit for yourself. Awesome.
Fantastic. Well, Dr. Levick, thank you so much. I've learned
Thank
a
you all
lot,
so
and
much
I
for
really
having me.
appreciate
It's
your
been a
time.
pleasure. Thank you.
Yeah, Doctor, we really appreciate your time. We really appreciate all the information, the reminders, the new information, just things that we can do ourselves without taking on some sort of great medical bill that many of us, we can't afford. So we can't go and do those things from the provider rendered strategy side. So
absolutely,
this has been fantastic. We want to thank everybody that has joined us. We truly hope that this has been of great value to you. And instead of me closing, I would like to pass the baton to our vice chair. We have one more announcement. And
we have two. We actually have two. Dr. Levick, before you go, can you go back to the screen where your QR code? I just want everybody to know I snapped the QR code that you had on the screen. Was so cool because what it gives us is a free assessment opportunity, which I love. So you can go, you can snap that. There it is. Scan me.
There you go.
It takes you directly to the app that lets you schedule, provide some, in-person information, or should I say virtual information. And am I right in saying that we get the opportunity to have a free assessment? Help me word it correctly.
Yeah. And even same goes if you were to come see us in person. If you come and we take a history and we do an exam, and I'm happy to kind of let you know my thoughts. And obviously, if we render treatment, that'll be a paid thing. But I would not charge anyone for a visit if we never rendered any treatment. So happy to do exams and give you at least some guidance if you have an injury and don't want to move forward with us as your point of treatment.
That's excellent. That is worth diamonds right there. We appreciate you giving us that assessment opportunity. So Q, I didn't want to let him go without everybody seeing that they had this opportunity.
Well, thank you.
Fantastic,
you.
but the floor is still yours, Vice Chair.
Okay.
Close us out.
I'm going to close you out. I have something very important to tell everyone. I hope people stayed on for a few more minutes. We're going to celebrate our 10-year anniversary as the Minority Business Alliance. This is our 10th year in convening as the Minority Business Alliance. So we hope that you guys will come out, our stakeholders, our members. It's going to be a time to remember. This is a save the date only. There will be more information forthcoming. Get your calendars out, save the date for Friday, September 9th. We will convene and celebrate at Glenmore Country Club off 250 East. We're going to have more information forthcoming in terms of tickets and sponsors. It will be a formal event. I know y'all haven't been out the house in a long time. I remember last time I shook my leg outside the house, Q. I can't even remember. As well as, I know you got a closet full of clothes you haven't worn that you would love to put on. So we're gonna ask you to put that date on your calendar. Somewhere in the next month or so, we will be charging you with very specific information. If you have questions, or we may even include some other conversation with some stakeholders who need to help us put that together. So Q, I think I said everything I needed to say.
I believe so. So. Alex, anything else?
I think that's it.
All right.
Andrea?
If you're interested in being one of those sponsors for our 10th anniversary gala, just let me know.
Absolutely.
We'll be happy to have you.
Absolutely.
And we are, and I know we don't have to say this, but we do want to assure everyone we are doing this, keeping everyone's safety in mind, because it's not like we can just plan our luncheons and events the way we've done in the past. We're being mindful that anything can change between now and September. So, but we're keeping all that in mind.
Okay.
All right. Well, the last thing I'll say, because that was an excellent point, is that just remember that we are a membership-driven organization, and our lifeblood is membership. So if you know anyone who has a minority business-owned company or a minority-led organization, encourage them to join the Minority Business Alliance. We're here and we're working for you. So pass the word, tell a friend, tell a cousin, an aunt or uncle. But we really appreciated all the information, appreciate your attendance, and we hope that you all stay safe, be resilient. We ask you for your blessings, and we pray endurance in your life as we move forward. We see you all month after next for our next meeting.
All right. Thanks, everybody.
Yeah, thank you.